In this video, we'll give you a brief example of team mapping. I'm Morgan Price, and I'm a team member of the ISU. Right now, we're going to walk through a little scenario. I'm going to introduce you to a patient persona as if you were a team member participating in a session and had already been given the orientation to how to do team mapping. I'm going to tell you a little bit about Dorothy and encourage you to map some of the roles and tasks, and I'll illustrate that on screen. I want to introduce you to Dorothy. She's a 70-year-old woman with a history of chronic obstructive pulmonary disease, so some difficulty with her lungs, osteoarthritis in her knees, and some sciatica. She's retired, used to work at the local hospital, and she lives alone right now. She does have one daughter who lives close by and checks in pretty regularly. She's active. She volunteers on several local boards. She's connected in with the clinic and has a family doctor there. But, the clinic is busy and often wait times are between 2 to 3 weeks. For Dorothy, at the clinic, who would be on Dorothy's team? So as a facilitator, I'd be prompting the members of the clinic, the team who are there, to talk about who Dorothy might see and who she might consider is on her team. Moving to the map, we start with an empty map, and we start to get ideas about who would be on the team. Often we would get a family doctor perhaps, or some other primary care provider, perhaps a nurse to help with some of the chronic illness. And then as we talk about it, we add tasks under the roles. So the family doctor may be involved in assessing acute changes, assessing how she is doing. The primary care nurse may be involved in reviewing the care plans, and so on. And over time, through the discussion, many different tasks can be put under each role. The tasks are meant to be adjustable so that as people talk, we can move them back and forth, or we can refine the tasks or split them or merge them together depending on what's needed. And we'll talk about that as we go forward. And then we introduce a scenario. So imagine it's flu season. Dorothy has had both of her vaccines by now for COVID, but she has developed a cough and it's become productive, and she's had some fevers and chills. And this is a pretty classic CPOD exacerbation. And this is a pretty classic COPD exacerbation. She called the clinic, but didn't say how sick she was. So she's not able to see her family doctor until later next week. And that day at the end of work, her daughter visits to bring some soup over. And she freaks out. She brings Dorothy, bundles her up in blankets and puts her in the car and takes her immediately to the clinic, to the medical home, and doesn't even bother to phone. They just show up at the doorstep and she says, "My mom's really sick. You've got to do something now." How does the team respond, and who sees Dorothy first? So this kind of prompt will trigger a whole series of discussions across the team about what do we do about unscheduled visits? How do we deal with people who look acutely unwell? Who's going to do triage? And triage will come up for sure in this scenario. And the discussion is, who is going to triage? Is it the nurse? Is it the physician? People will argue in both directions, and ultimately, both options are valid, and it depends on how the team wants to work. If the physician wants to have the capacity to triage acute conditions, great. If the primary care nurse wants to have that capacity, and maybe they were previously an emerge nurse, fantastic. But it depends on the team, and it's much better to decide this now than it is to wait until that moment when Dorothy walks through the door and everybody sort of scrambles. So it's a way of getting people thinking about how they want to work together. And that's how team mapping helps build the team. They build the map as a team, and through that work, they become more of a team. Thanks for listening.